Well, we've actually, at Homeward Trust level, we've had maybe 3 or 4 projects. Actually, I think 2 from outside of the province, looking at some national, or some a national study on housing first, and one was on permanent supportive housing. The Addiction Recovery Community Health Program or Clinic at Royal Alexandra also submitted a request through us for access to homelessness data. I'm trying to remember what the 4th might be, but it's been a handful. Jenny may be able to speak to, I know that the University of Calgary has pumped out a lot of requests for information, Dr. Kneebone being one of those. Oh, perfect, Darren would be able to, oh, actually, I'll start with Jenny, and then she may defer to Darren for that.
At provincial level, and we didn't collect the detailed data for each CBOs, how many projects they have, and because we collect the data at a very high level, and for the research project, and actually for the research projects data request, we received a lot of requests, and through this type of information, we know some project is going on, and specifically, I think. From our perspective, data management and the reporting perspective, we would like to have further conversation and how to use systematic approach and collaborative approach to involve more with communities, partners, and to learn more about their research project, to understand, to have better understanding how we can support their project and to initiatives and programs to end homeless.
Yeah, just follow up on that. In that process, giving access to the researchers' data, have you encountered any challenges and how you overcome them?
I can speak from Homeward Trust perspective. Short answer is no. I mean, typically the requests that come through us go through institutional ethics approval. It's data that we have. We've been very fortunate. I mean Alberta Human Services and its names prior to that have the people there have been very supportive of mobilizing data. It's a pretty straightforward application form. Basically, they come to us and say, "Well, do you guys support it?" And again, if there's been an ethics review, we sometimes will take requests like that to our research committee, but for the most part, if it's a pretty straightforward request, we'll support it, send it up to the province. For the most part, they'll use data from us, but in some cases it will be from the province. But it's been I mean, like I said, we've only dealt with 3 or 4 of these requests, and all of them have come with ethics approval. And so it's been a pretty straightforward process for us.
Yeah, this is a question for Robbie. If I understood correctly, you guys are collecting a couple of unique identifiers in terms of social insurance number and AISH program number. What's interesting about that is that it opens up the whole arena for record linkage and creating a more holistic understanding of the client, as we saw the CYDL folks are involved with and so on. Is that where you're going with this, to do those kind of deeper analytics? Like, why are you collecting that? Is that the end game here?
Some of those things are case management issues. And having the ability to interact with an AISH worker and say, oh yeah, this client's number is this. And so there's actually no research agenda behind it. But where it exists, it opens the possibility for some of those data linkage analysis if it can drive us to program improvements.
It's interesting. I mean, with the data system is really about case management, so the worker can keep track of the information they need, and so I mean, in many respects, it's secondary use, and like we haven't used social insurance number or H numbers or any other kind of numbers for any kind of research or evaluation purposes. But yeah, I agree with Robbie. I mean, there is that potential, but there are many, many sort of hoops we would have to jump through before we can even think about mobilizing that. And it's not consistent either in terms of that collection. It's really worker by worker.
Those ones are optional data fields that are occasionally filled in and occasionally not.
Hi, I'm hearing anecdotally that there is a need for palliative care for the homeless, and I'm wondering if you have any data that would support that.
Sort of. Clicking through my brain quickly here. Partly our kind of the data sets that I showed you are our clients who are no longer homeless. So the more detailed information we actually have is on housing and on the initial bits of housing. We do have the homeless count information and the homeless connect information for people who are currently experiencing homelessness. And those don't get into much depth on health issues. The bit that's hopping to mind is we've got a chunk of clients who have COPD or advanced terminal illnesses. And I'm trying to flip through my head in any kind of, I think the only way that we're tracking that is specifically in our graduate rental assistance program. We're just beginning this tracking of people with severe medical conditions. Do you have anything else in mind?
Yes. So with the implementation, or sorry, with the launch of the 20,000 Homes campaign, yeah, we've started using the VI SPDAT, which adds the vulnerability index, which is I think 7 or 8 questions that really focus on risk of mortality, and so it incorporates those questions with this SPDAT tool. So we've just started using it as part of our coordinated access program, as well as with the 20,000 Homes campaign, and we've registered some 700 chronically homeless people for whom we've collected that data. And like I said, it does, I mean, I can't remember exactly what the questions are, but it looks at like liver disease and I believe HIV and other vulnerability indicators. So does it get to the point of the need for palliative care? It's starting to. I think the biggest potential would be around the AHS data that might be available for both our Housing First clients as well as for permanent supportive housing. I agree with you. It's been a pretty top of mind issue for quite a few years.
Thank you.
Actually, there's a question from Webcast.
Oh, hey, that's right.
I'll read
Hi,
it.
Webcast people.
So this is a question for both Jenny and Robbie. For the research grants, how would you define the need for collaboration for academic and non-academic stakeholders? And if the existing data for the existing or requirement for the research data, what is the evidence-based? So I guess let's start with the first part. For research grants, how would you define the need for collaboration for academic and non-academic stakeholders?
Sorry, for research grants, specific to, and I'm just not clear on whether we're talking about SSHRC research grants or Homeward Trust research grants or
It's not specific.
Sorry,
well, dear webcaster.
can you repeat that question again?
So for the research grants, how would you define the need for collaboration for academic and non-academic stakeholders? So is this a broad, maybe it's a like...
That sounds like a question for a community-based research funding, which is a little bit peripheral to this. Feel free to email Maricon in that regard. Jeanette, did you have something to say?
Jeanette will answer.
I don't know, but I'll weigh in on this because I'm a very, very strong proponent of the absolutely essential need for community collaboration and academic collaboration for several reasons. And so we can do some of the technical reasons. One of the technical reasons is that often local organizations don't have access to ethics review boards, and you want to make sure that the research protocols are being run in ways that are very respectful of human subjects in any kind of research project. The second thing is that the academic often has the access to the databases that allow them to really research whether or not the existing work is cutting new territory or fits in with the existing information that's already available, to what extent it supports it or adds to that. But most importantly, from a very pragmatic point of view, what I found over the years is the biggest challenge for an academic doing research that involves real live people in real live organizations is building the relationships within the organizations to actually allow you to have a good partnership that gets the data, and then it gets the data back out to people who need it. So you really essentially need that partnership to make it happen. And I've really tried, for me especially, and I know a number of my colleagues, tried to stay away from any kind of research that does not involve a community collaboration. The research funders often look for that collaboration as well, so having that in place, it was really a value added in terms of assuring the funder that you're going to be able to deliver on what you're promising in your research application. I think that's a quick summary of at least what my biases are.
And I'll just reinforce Ron's point from earlier today that I'm an economist too, sorry. That we crunch numbers and then come out with results, and we need people who deal on the front lines to tell us what those results mean and interpret a lot of that information. So there's a two-way knowledge flow there. Sorry, there was a second part to that question, wasn't there?
So the second part of it is if the existing data for a requirement for the research data, what is the evidence base?
I suspect that those two questions are either related to Homeward Trust RFP for community-based research projects, or the Alberta Centre for Child, Family, Community Research's seed grants. So we will respond, webcast user, if you can send an email to Maricon, we will be sure to get the answers to those questions. In some cases, it may, we'll connect with
actually, she says, thanks, Jeanette.
Oh, perfect. Jeanette has answered the question. Thank you, Jeanette. Other questions? Oh, Kofi.
Yeah, so for Robbie, in relation to the SPDAT tool, is there anything being used to measure housing stability and evictions in the city?
So SPDAT will give a history of homelessness score that's just 0 to 4. Housing stability comes from some of the other data sources, the housing placement form I talked about. On the provincial assessment, every 3 months we're asking, has this client achieved 3 months, 6 months, 9 months of permanent housing? Have they been rehoused in the last 3 months? And then every time a client is rehoused, we fill out a new housing placement form. And one of the questions there is, why did this rehousing happen? Was it because of an eviction, rehousing for positive reasons? What was going on?
Okay. And for Jenny, is some of the research that you're undertaking from your end being used to inform the programs that are being implemented by Alberta Human Services, like plans to end homelessness or grants that are given out to people?
I'm not sure how I can answer this question. Darren, would you like to jump in? and from yeah, and yes.
So I'm Darren Jocelyn. I'm Director of Program Policy Integration in the same unit that Jenny works in. To be honest, we're not doing as good a job on that as we could and as we should. we are 7 years into the plan. We're about 5 years into really good data. And so now that we're really solid in the data, I think we have the opportunity to start turning some of this around. And some of it involves some work that, as many of you know, requires information sharing that is difficult to achieve. And I'm going to talk about a project that I swore to God we wouldn't talk about today, but I'm going to anyways.
Do it.
We're currently working on what we call the Quality First, or the Housing First Quality Improvement Program. The 10-year plan identifies four overarching outcomes. One of them is that at any given time, 85% of the people housed under Housing First will remain housed, will be housed. Then it speaks to reduction of emergency systems use, improvement of mainstream systems use, and a source of income. We've got great self-reported data. In some of those categories, it's almost as high as 70, 75% reduction in emergency systems use. About the lowest is right around the 50% mark. So basically, it looks like housing people's making a big difference in that. But it's all self-reported data, as Jenny had said. Our intent is to actually go to the data, to the actual people who hold the data. So Justice and Solicitor General, Alberta Health Services, Health, and the court system, the police systems, and try and validate that data of the individuals who have been housed. So that's up to over 12,000 people now that we would like to try and validate that. And it's been very, very difficult to get the information agreements. We're currently dealing with VoIP. We're also dealing with the Health Information Act. We're dealing with different legal interpretations of that. We're dealing with having to build a system that will help us in doing it. And so we've been working on this project for a while. I won't say how long, 3 years, 4 years. But so I guess what I'm saying is we haven't done as much as we should and as much as we could. I think that we're finally at a place where we feel really comfortable and secure with the Housing First data. We believe it's very good data, very comprehensive data. But we're still working through the systems of how it is that we use it. And I guess I want to say, and this is maybe one of the, why did we say 10 years? But that's all part of learning as well. That's all part of our learning at the government level. What makes sense if you're going to put a timeline on a strategic plan, and what's the plan when it's no longer the strategic plan but becomes a program or a policy or a direction or whatever it might be. And there are still some questions around that as well that we have, and so it's made it difficult. So, I mean, I didn't really answer the question, but I think I gave you a sense of what it is that's been some of the frustrations as to why we maybe haven't done it as well as we could. With that said, we do have a number of people who have accessed our data over time, and we have worked with ACCFCR on a number of different projects through the Interagency Council. We'll talk about that a little bit later on. They've supported folks like Jeanette to do work that we have, Human Services has supported and gotten behind. Really appreciated what you said about partnership, and particularly appreciated what you said at a few events ago when you spoke to how important that was when we're dealing with our Indigenous populations and our Indigenous communities. Absolutely. We've studied to death. Let's work with and make something that's helpful for both sides. So well, I'll leave it at that for now, but it gives you a sense of the complexities of the work that we're trying to do.
Great. Thanks, Darren. Thanks, Kofi, for the question.
Thank you, and I just thank you for all of that explanation. I think that really helps all of us. I want to follow up on one thing. Where did you get your 85% housing retention number from? And maybe I will be a dog with a bone on this, but the whole issue. I become increasingly concerned and wondering as to what are the real true housing retention facts with with different variations of how Housing First is delivered. So where's the 85% coming from? Because that seems to fall outside of the ballpark of what numbers I've been hearing.
So the 85% is the number in the plan, and it's the outcome that was developed with the 10-year plan. And I have to admit that was before my time, but it was the number that at that time, Housing and Urban Affairs chose to put in the plan as the outcome, the 85%.
So is that a political number, or is that based on research?
I don't know. I
You know-
really honestly don't have an answer to that question.
So, to follow up, can everybody hear me? 'Cause I got a
No, you have to use the mic, sir.
Oh, great. Now we're going to be just right here
Yeah,
in each
we're-
other's face
Anyway.
with the mics.
We're not going to be doing
Okay,
that for too
so,
long.
so the at-home Chase swap project, and we're all in this room, I hope, familiar with that. Their housing outcomes at the end of 2 years were 66% of people were housed all the time. 66%, okay? All of the pathways to housing studies in the States run between 68 to 78%. Only one has 78%, and that seems to be an anomaly. The stuff that I did showed 72%, okay? So it seems to me that 85% housed in Housing First defies the odds or all of the data that other research has reported, which is why I wondered, I don't want you to be set up with numbers you can't achieve and then be held up to failure. That's no fair
Well,
either.
That
ahead,
probably
Darren.
would
I
have been
have
more
some
helpful in 2009, but no, just kidding, when the plan was set. But I agree with you, but I think also that's where our opportunity comes and some of the things that we need to do when Jenny was speaking to the fact that we do need to revisit some things. We do need to actually take a look at it. Was it a well thought through number? Do we need to visit it differently? Depending on how we report it, if you look at the number of people who remain housed through a fiscal year, our numbers are very high. If you look at it across the time of the plan, of course, they just go down and go down and go down, 72, 73. But you're right, we need to figure out, is that something that we want to hold
That's-
to or to
Well,
move on?
but you have very high numbers that are housed across the fiscal year, so that's part of your
Yeah.
data set. So where does that data come from? And then I'm going to give up and turn the mic over to somebody else.
Yeah, sure, great. And yeah, Robbie can speak to that, and then I have some comments about the 85%.
Did you want to get in there, Jenny?
Or Jenny,
I
sorry.
can speak a little bit about that. And because in our data system, like Darren mentioned, is very complex, and we have very complex mathematical formula to calculate the data. And plus, I think there are a few factors need to keep in mind. The first one is at the first 2 years when this plan, the 10-year plan implemented, start 2009 and 2011. So the data actually we collect across province is not really totally completed and reliable. And because at that moment there is some technical issues, and we collect the data and through the collaborative process, but sometimes we couldn't get the complete data and from agencies. So the data is not 100% accurate. So that is one factor. The second factor is, and when we do this calculation, so we have two different formula. One formula is only calculates the current fiscal years, and from current fiscal years, we do see the increase for the client to stay in the house, in-house. So that's, you mentioned is 30, 91, 93, 94 increased, sometimes a little bit changed, 92. But the calculation since 2009, it seems around between 73 and then 80, 87 or something like that. They changed a little bit and stay down at 73. But this number, and when we look at the formula, and we found there's some something we can improve, we can redesign that formula to interpret the data differently. And because right now is the way how we calculate the data and may not reflect, so all the programs, all the projects, and all the services we provided is just a partial of the services and programs, is not the whole picture.
And to Darren's comment that this progressively goes down and down and down, that's because the indicator is designed to go down and down and down. Pardon me, it was rather foolishly designed. And so I'm glad to hear that we're looking at revisiting that and getting something that's more comparable to other jurisdictions and other methods.
Got a question up there.
But it's a two-parter, really. One's a comment on some of the numbers that were developed back in 2009, is that back then there were not a ton of Housing First programs or a lot of research done on Housing First. And since then, as a funded agency of Homeward Trust, is that we've actually been looking at some of that data and adjusting the practice to help increase the retention rates in housing and stuff like that. One of the specific things is determining what exactly housing means for an individual. Back when the 10-year plan rolled out, it was one individual with a lease for a year with insurance, so on and so forth. And now we're looking at a little bit more of what's going to work for the client that's actually going to fit for the health and the tenancy retention of that client, right? So we're becoming a little bit more broad in our approach to solving homelessness and less laser beamed out to this is the solution for everyone. The second part is, with all of the information that you guys are gathering, and with only 4 years left to end homelessness, have we teased 3 years? Have we teased out what we can do to start working on some prevention pieces?
Good question. Well, Robbie did a little chapter on this. Good plug. That wasn't planted.
Yeah, it wasn't.
Yes and no. I'll say the referencing the chapter that Gary was just talking about, the Canadian Observatory on Homelessness just released a book that I wrote a chapter in looking at inflows and outflows in the homeless population with Edmonton as an example, what data we had and didn't have. And the bottom line there, as Zero 2016, the campaign in the States has said, is you've got to increase outflow beyond inflow. And there's two ways to do that. Either you increase outflow, you get more people housed, or you decrease inflow. You reduce the number of people becoming homeless or becoming homeless for any length of time. So most of our work to this point has been on the outflow piece. How many people can we get housed? And I think we're just in the process of stepping back and saying, okay, how do we deal with this inflow problem? And are we doing the best job of funneling people to services appropriately through our diversion efforts and our prevention efforts? And there's a little bit of work starting to happen. Partnership we just launched with the Institute for the Advancement of Aboriginal Women that's doing a lot more work on trying to prevent people from becoming chronically homeless.
Jenny, did you have anything to add regarding prevention? Any data being collected on prevention of homelessness?
I think from prevention level, and then we do have some discussion happened in terms of data collection strategy and the data sharing strategy and the data usage strategy. And specific for the data collection, and right now if we look back to the history and what type of data we collect and cross province, and we are more likely to focus on after the homeless. So we collect the data, and when our clients come to the service, and we collect the data through that, and then how to draw the root cause for the homeless, and for the data strategy, for the data collection, the strategy. I think that conversation, that discussion right now is going on to how we can collect data and for the existing approach, and what is a different approach we can more focus on, not only after the clients come to our services, but even before.
And I think that's an important point. It's really understanding the trajectories that different people take before they get homeless, or before they become homeless, and then looking at the data sets. One example, and the conversation has just started on that, but the food bank, for example, keeps they keep a database of everybody who's used their service. And if you want to talk about the steps for a certain group of, or a certain subpopulation, certainly starting to go to the food bank to address food insecurity might be a step before you actually run into that housing insecurity, or maybe linked. So looking at that, there's also the Child and Youth Data Lab information. So 0 to 30, at what point do people become homeless? I mean, these are all data sets that we should be exploring.
And I will say that this is a little bit of a contentious issue. If Ian DeYoung were in this room, he would be telling you to forget it, don't do prevention, focus all of your resources on intervening as early and effectively as possible, and applying the appropriate resources to people who need housing. His take is that you can't actually predict homelessness, that we haven't established a robust causation correlation piece, and so the resources are better applied elsewhere. But that's another argument that we'll leave for another day.
I think another piece of policy that we need to take a look at, and I know you've had your hand up, so I'm sorry, but you know, in 2015, we released the youth plan. And a lot of the youth plan is focused on prevention and diversion activities, and it's really not, housing first is an option, but really the language is family first and reunification, and it's about creating that meaningful connection to family as the young person knows it. It's about addressing the needs of the LGBTQ. Oh man, I can't believe I tripped over it. I've been perfect on it for months now. LGBTQ2S, thank you. Community and what that looks like. So I think that we are thinking about it from that lens. Some work that the Interagency Council on Homelessness has done is developed some tools that currently we're looking at within government, one of them being a diversion table that was developed out of Red Deer, and how that could become something that might be in a provincial approach that would be further upstream. I guess the last thing that I'll throw in is that Human Services is going through, well, has just gone through a major reorganization, and part of that is to integrate service delivery at the regional level. And I've been around in the system for a very long time, and I remember when we all were based in one office. As a supervisor, I oversaw AISH, I saw family maintenance, I saw income support, I saw handicapped children services, I saw SFI Plus, which was the precursor to PDD. That was all my team. So when you went in and you saw my intake worker, they would recognize, okay, you've got enough going on here that we should at least get an AISH application started and those kinds of things. And I've got to hope that if you know, the ISD model in Human Services does nothing else, it'll at least determine people's needs at an earlier stage in involvement, and maybe that homelessness will, even if currently homeless, maybe we can have some secondary prevention, and even if you've been homeless for a long time, maybe we can have some tertiary prevention as well. And that's something also that I don't think we look at as Human Services, is that our interventions can be prevention as well, one way or another. So I think we've got some things on the go, but you're right. We talk a lot about prevention, but we invest in intervention, and we need to figure out how to turn that around. Absolutely. It's a huge discussion on an ongoing basis at our policy tables.
On the top of Darren's comments, I think that to address prevention and the specific initiatives and for the data strategy development, so one piece is very important. We are already started the conversations about data system integration, and because to support that integration services, how we collect data can through this integration process and cross the different data system, because the different program for specifically for the prevention programs, we have different data collection process, but how we can integrate them together and to get the data and from the big picture and from meaningful, sorry for my English, and meaningful fashion, and is not about independent each data system. So we collaborate all the data system, we look at the root cause for the homelessness, and then we look at the intervention, we look at the prevention from different perspective.
Thanks. It's a very patient man there, and then we'll finish with Kyle.
When I look at the range of information that's collected by Homeward Trust and the sophisticated way in which you apply that information, it's impressive. And I think about other service delivery agents that may be at that level, some may not be. What's the culture like in terms of knowledge exchange and data sharing and information sharing across entities that are in this space? I mean, you mentioned the food bank and so on. Do you guys compare notes? Like, what does that landscape look like?
It's a good question. To a large extent, it's really any kind of information sharing that does happen is really focused on specific initiatives, specific projects. Not all agencies are involved either. One example, the Heavy Users of Service project that's led by the police and City of Edmonton has a whole group of agencies participating with that. There's an MOU, there's information sharing agreements, all that. There's a little bit, I mean, there are many agencies that use the same data system that we do, the efforts to outcomes. And you can see that some have really sophisticated, I don't know where Maria is, she walked out of here, but Bissell Center is one example. I mean, Hope Mission's been using it, E4C, there's a whole bunch. And so they have a lot of data. The question is, to what extent are they, do they have the capacity for analytics? And so Homeward Trust has been looking at ways that we can support agencies and not only having some kind of consistent way of data collection, so for the potential of information sharing, but how can we support on the analytics side? How can we, so we're coming like a long way, and I think a lot of people aren't aware of that, even at the agency level, but we still have a ways to go.
Robbie? Hey, you're the guy. Okay, hello. Sorry if someone asked this. I got caught in the open City Edmonton graph thing. That's really not what my mind was made for there. So sorry if this was answered before, but let's say that when I was on the streets, it found like it's like there's a 2-week period of like the kid wants to get off the streets, and after 2 weeks, it dies completely, and they're caught up in this culture of homelessness, and then it's kind of gone for like months or years even. I feel like there should be, maybe you can tell me if there is like some type of like instant sort of housing thing to get them out of the culture of homelessness. What are the challenges presented with having a program like that? Because now that I'm kind of volunteering and stuff, I'm being part of the conversation that there's really no quick exit out. It's either like a month-long wait or a shelter, which isn't really a solution. Can a program like that exist? Could you talk about it maybe?
It can, and there's a question of, there's a couple questions here. One of them's about prioritization, and one of them's about how you divide your resources. So you're talking about kind of the first 2 weeks when you're homeless. Is that what you're?
That's either the deciding factor whether you're not homeless or you stay homeless.
Right. So most of the Housing First model as it exists is prioritizing the clients in highest need, which starts at the other end. It says who's closest to death or least likely to be able to house themselves. And then you're starting with people who are already chronically homeless and saying these are the people who need the most support. The evidence, and this is where I'm going to bring Ian DeYoung symbolically into the room, from his side is that a lot of people will house themselves in those first 2 weeks without any need for any kind of support. They'll get it done by themselves. But you're pointing out the other side of it, which is, well, that chunk of population who aren't able to house themselves, that's the time in which the support is the most effective. Before you've walked farther down that path of developing connections and sometimes problems within the culture of people experiencing homelessness. So do you want an intensive case management intervention for someone who's been homeless for 2 weeks? Absolutely not. But might there be other lighter touch interventions? Potentially, yes.
Thank you.
Yeah, and I think that speaks to
Disagree?
data for the purposes of collaboration and intervention as opposed to just the analytics side. So, I mean, Medicine Hat, we all know, you know, they've ended homelessness. They're still working on it, although they've made significant progress. So when somebody shows up in a shelter, the data is collected, immediately they're assessed, and then they're connected to the right service, right? So if we had that kind of data integration in the city, whether you show up at the emergency room or you show up at the shelter or wherever it might be, if it's determined that you're homeless, or maybe you're reaching out because you've just become homeless, I mean, that's when we need to trigger that screening. And then, as Robbie said, you can, for those people who are likely not going to be able to help themselves out of homelessness and find housing and so forth, we really need to get that intervention in right away. So it is possible, and data can play a very significant role in that. So that's kind of where we're trying to get at with, you know, more agencies using data and all that. Actually, I think we are at lunch.
One comment, because I think there's a data point that's missing.
It has to be the mic.
That's missing from the conversation, and that is we've got to start, I think, also talking to landlords and getting a picture of what is the role that landlords play in either creating homelessness, which kind of was alluded to by Ron this morning, or in perpetuating a cycle of homelessness because of the evictions that come about, for example. I don't think we have enough data on landlords, and landlords who either work with vulnerable people or are too quick to marginalize them and push them out of housing. I think that's part of the prevention strategy.
Absolutely. I think, and Kofi would be very interested in talking more about that. He is with the city working on an eviction prevention strategy. So thank you for that.
We call them property tyrants.
Property what?
Property tyrants.
Property tyrants. So let's wrap up, because I think we're at lunch, right? So thank you, Robbie, Jenny, Darren, Jeanette, everybody who's contributed to this.